This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Today, we're going to talk about a condition that doesn't directly affect men's bodies, but has a profound impact on their lives, their relationships, and the well-being of the women they love. It's one of the most common afflictions in medicine: recurrent urinary tract infections in women. This may seem like an unusual topic for a men's wellness podcast, but if your partner has ever suffered from this relentless cycle of pain, anxiety, and frustration, you know that her health is your health. The constant disruption, the impact on intimacy, and the worry of seeing someone you care about in chronic discomfort affects you both. The way we manage this condition has undergone a seismic shift, moving away from a simple kill the bug mentality to a sophisticated, evidence-based strategy focused on prevention, preserving the body's natural defenses, and breaking a vicious cycle. Understanding this new approach is one of the most important ways you can support your partner and reclaim your life together. So, what exactly is a recurrent urinary tract infection, or RUTI? This isn't just a woman having a couple of UTIs spaced out over many years. The official guideline defines it as 2 or more culture-proven infections within 6 months, or 3 or more within a single year. The key words there are culture-proven. For years, many women with urinary symptoms were treated with antibiotics without confirming an actual infection, leading to a cycle of overtreatment. A true RUTI diagnosis requires documenting a bacterial pathogen from a urine culture that is associated with acute onset symptoms like painful urination, urgency, and frequency. It is also critical to distinguish a UTI from asymptomatic bacteriuria, or ASB, where bacteria are present in the urine but cause no symptoms. One of the most important principles in modern urology is that we do not treat asymptomatic bacteriuria. The mechanism behind RUTIs is more complex than just bad luck. While an acute infection is caused by bacteria, usually E. coli, ascending into the bladder, the recurrence is often perpetuated by our own treatments. Every course of antibiotics, especially broad-spectrum ones, causes collateral damage. Think of it like this: your partner's body has a healthy ecosystem of good bacteria in the gut and vagina that helps keep pathogens in check. Antibiotics are like a broad-spectrum herbicide. They kill the bad bacteria, but they also wipe out these protective colonies. This leaves the urinary tract more vulnerable to reinvasion by pathogenic bacteria, creating a cycle where the treatment for one infection can set the stage for the next one. The modern approach is about breaking this cycle by promoting antimicrobial stewardship, using the right antibiotic for the shortest effective duration, and focusing on prevention to reduce the need for antibiotics altogether. This new way of thinking is formalized in the 2022 AUA-QA SUFU guideline on recurrent uncomplicated UTIs in women, which is based on a rigorous systematic review of all the available medical evidence. What's truly new is the strong emphasis on non-antibiotic prevention strategies and the mandate to avoid overtreatment. For example, the guideline makes a strong recommendation, the highest level of endorsement, that clinicians should not treat asymptomatic bacteriuria. This is a proven strategy. It also provides a moderate recommendation for the use of vaginal estrogen in peri- and postmenopausal women, a non-antibiotic therapy with excellent evidence for reducing UTIs. Unfortunately, these evidence-based practices are not always followed, and many women and their partners are not aware of them. There is a deeply ingrained pill for an ill mentality in medicine, and many providers still prescribe antibiotics based on symptoms alone, often using broad-spectrum drugs that contribute to resistance. Patients, desperate for relief, may even pressure providers for these non-guideline treatments, not realizing the potential for long-term collateral damage. Myths about prevention, like the effectiveness of specific hygiene practices, also persist, while proven strategies like increasing water intake are underutilized. Educating the public about this new, more holistic approach is essential to improving care. For a woman with UTIs, the patient experience should start with a complete history and a pelvic exam to rule out any anatomical issues. For every symptomatic episode, a urine culture should be obtained before starting treatment to ensure the right antibiotic is chosen. The core of the experience, however, should be a detailed conversation about a personalized prevention plan. This involves discussing the risks and benefits of all options, from lifestyle changes to non-antibiotic and antibiotic prophylaxis. For select reliable patients, a urologist might even offer a self-start therapy protocol, where the patient has a prescription on hand to begin treatment for a symptomatic episode while awaiting culture results, empowering them to manage their own care responsibly. This is the pinnacle of personalized urologic care, creating a long-term prevention strategy tailored to the individual woman. For a post-menopausal woman, the first-line recommendation for prevention is often vaginal estrogen therapy, which restores the healthy vaginal microbiome and reduces infection risk. For a younger woman whose UTIs are clearly linked to sexual intercourse, a single dose of a prophylactic antibiotic taken right after sex may be a better option than continuous daily antibiotics. For others, non-antibiotic options like cranberry prophylaxis may be offered, or the choice may be made to use daily low-dose antibiotic prophylaxis after a thorough discussion of the risks, including antibiotic resistance. The plan is not static, it's a dynamic strategy developed in partnership. The effectiveness of these strategies is well documented. Antibiotic prophylaxis can reduce the risk of having a UTI by nearly 75% compared to placebo, although this comes with an increased risk of side effects and resistance. Vaginal estrogen therapy in postmenopausal women has been shown in multiple trials to significantly decrease the incidence of UTIs. And in women who drink less than 1.5 liters of fluid a day, simply increasing their water intake has been shown to cut their UTI rate in half and nearly double the time between infections. The most effective strategy is the one that is personalized to the patient to break the cycle of infection and antibiotic exposure. The future of managing UTIs is incredibly exciting and is focused almost entirely on moving beyond antibiotics. Researchers are exploring the urinary microbiome to develop targeted probiotics or even fecal transplants to restore a healthy, protective bacterial ecosystem. The development of effective vaccines against common uropathogens like E. coli is a major area of investigation. And new non-antibiotic therapies, such as manicides, which are molecules that prevent bacteria from adhering to the bladder wall, are also on the horizon. The goal is to build up the body's natural defenses so that antibiotics become a last resort, not a first response. I do this work, and I bring this topic to you on a men's wellness podcast, because supporting a partner through a chronic illness is a team sport. This is not just her problem, it is a challenge that affects your shared life. Understanding the science behind our UTIs and the importance of antibiotic stewardship empowers you to be a better advocate and a more empathetic partner. The better way forward is a path of prevention, not just reaction. It's about having open conversations, making shared decisions based on evidence, and embracing a holistic approach that prioritizes long-term health over short-term fixes. By doing so, you can help the woman in your life break free from this painful cycle and restore health, well-being, and intimacy to your relationship. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.